There's TMS, then there's MeRT, and I'm not a clinical person, but I look at it as the TMS is like the machine, if you will.
Right.
But MeRT is really the proprietary protocol that's utilizing this machine. But maybe just give people a feel for what are we talking about here? What are we trying to achieve by using this technology?
Sure. So exactly as you said, TMS, transcranial magnetostimulation, has been around for 25 years. It's in research and finally has FDA approval for conditions like depression, OCD, addiction, with anxiety, traumatic brain injury, and particularly PTSD. We're currently in the midst of a multi-site, multi-year double-blind sham-controlled study for PTSD as well. TMS was FDA approved for a very specific frequency for the average human brain, between 9.6 and 10 hertz, which on the Earth, the average human frequency, or how fast the brain is operating in its normal or optimal function, is about 9.6 to 10. And so that personalized frequency is what makes MeRT different from TMS, in that we can measure everybody's brain function with a QEEG. It takes 10 to 20 minutes, and analyze the data from just a standard EEG, turning it into a quantitative EEG, determining frequency, where the brain should be operating at its optimal function. And we can then program TMS to a different frequency that's similar to or exactly the same as within a 0.1% margin of their optimal brain function, and treat them at that frequency. Everybody has an optimal alpha week. It's where your brain should operate when you don't have drug addiction, traumatic brain injury, depression, medications, substances, so on and so forth. And that is always measurable on an EEG. For instance, in a traumatic brain injury, you are generally seeing a brain that has completely slowed down. The whole cortex is not operating optimally after a trauma. And you can see that there's several portions of the brain or multiple networks that are operating at a much slower frequency, but there's always a signal on the EEG that shows where the brain should be operating. Our goal with MeRT is not to treat the standard brain, but to bring the brain back to where it should be operating.
In our space, we're dealing with a lot of anxiety, generalized depression. We're trying to treat this differently than just the use of medications. And I found over time it's not necessarily either one or the other, but sometimes the combination of the two can be highly effective. And when you start looking at functional psychiatry, we're broadening the scope of what might actually impact symptoms or psychiatric symptoms within the brain. But we're trying to, and are doing it right now, applying this in our treatments in 2025. And I feel like it's going to be a game changer because it's opening up avenues of treatments that people that have suffered with psychiatric symptoms have never really had access to.